Angela Newman-White began her public health career as a case manager for the Cleveland Department of Health's Mom First program, and now she's at the helm of First Year Cleveland, an organization dedicated to tackling infant mortality and maternal health. I sat down with our latest game changer, now starting her second month as executive director, to understand why infant mortality remains such an important issue here in Northeast Ohio. Angela Newman-White considers herself a fixer.
I just feel like it's in my blood or in my heart to help people and help communities.
For the past 20 years, she has worked in maternal and infant health, helping to elevate voices who need to be heard.
I've always had these high expectations for myself and knew that I would be instrumental in provoking some type of change.
Now she faces a huge challenge as she steps into her new role.
We got to fix a broken system because the system has been broken, historically broken.
That's because infant mortality remains a significant issue here in Northeast Ohio.
In Cuyahoga County, Black women are 3 times more likely to lose their baby as white women. Our job here at First Year Cleveland is to not only provide the education and the support for the communities, but then also to advocate on a policy level to provide better conditions for families to thrive.
A public-private partnership now housed at the Mandel School of Social Work at Case. The organization was formed in 2015 to help address Cuyahoga County's concerning infant mortality rate. For more than 5 decades, one of the highest in the country.
It's a symptom of a greater problem, and it's really, based off of institutional and structural racism. And so that is the actual root cause of infant death. First Year Cleveland definitely is looking to continue to support and seek out to support organizations that work with families in under-resourced communities. We're definitely, social determinants are high on the list. And healthcare, racism in healthcare is huge.
First Year Cleveland's mission is to ensure that every baby celebrates their first birthday. How do you do that? How do you fix this issue?
A lot of changes are made at high levels without consideration of how it translates on the ground. And the answers are actually within the communities. And so I think by engaging people with lived experience of whatever you're trying to address, when in this case infant mortality, and using that to drive the decisions, I think that's at the root of, how do we start this?
The higher the rates of infant mortality, the less healthy a population is overall, and it touches more lives than we may even know.
Prematurity is the leading cause of infant mortality, but prematurity is actually dependent on mom's health and well-being prior to her even becoming pregnant. And so trying to shift the narrative from focusing on the infant dying to mom's overall health and well-being is the challenge.
Now a Twinsburg resident, married with an 8-year-old son, it's her childhood, growing up with a single mom in Shaker Heights, that inspires her every day.
We grew up in poverty, and she couldn't make ends meet. I just knew I wanted to help people. This is a way that not only can I help pregnant women, but I can also be looking to address those larger structures that impact everything. When we're talking about education, transportation, food access. This is going to be so much bigger, and infant mortality is just going to be one of the benefits.
Well, she feels they have momentum. There has been a promising reduction in Cuyahoga County's infant mortality rate since 2015, but still so far to go, particularly when it comes to racial disparities. So how does she distress from such an important job? She's a fitness fanatic. Morning, she wakes up every morning at 5:30 to work out. She says she can't go without getting that workout in. Yeah. But she's the type of person that you want on your side. She says she's going to challenge the system. She's going to make it happen. She's one of those people that she doesn't necessarily seek out a job. People seek her out to do the job.
Yeah, and the work she's doing is so important. We've covered it for years, how Cuyahoga County has always been at the top of this list. Northeast Ohio, not just Cuyahoga County, too, has always been at the top of the list of infant mortality. And you don't want to be known for that, throughout the nation. So I know hospitals have been working on this. There's other organizations working on it. So she is surrounded by people who are working toward the same goal, which is great. Yeah. But we just need more of her.
Yeah, the numbers prove what you just said right there. And I think a big thing that hit me in this is how it affects everybody. Yeah. Not just, and people, and as I mentioned in that piece, you might not even know it.
Right, yeah. All right. Well, thanks for introducing us to her, Dave.